Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Many of us self-medicate, and we have made it a habit to purchase over-the-counter drugs without prescription. Health experts say painkillers are some of the drugs people purchase most without any prescription.
Probably if there was no pain, there would be no doctors. And the number of concoctions as painkillers that we have over the counter will tell you how important a symptom of pain is.
Now, many of you who buy painkillers will testify that you take them according to how you feel because you want instant reaction from the drugs.
If tissues are being damaged or tissues have been damaged, an inflammation can also cause pain. Sometimes pain can come from the brain. The brain is telling you there is pain, and yet there is nothing which is really paining a person.
According to Dr. Vincent Karuhanga, this means you are emotionally attached to the painkillers,
which include brufen, diclofenac, and so on and so forth.
And this is how it will impact your life.
The unfortunate thing with these ones is that they cause peptic ulceration and they can damage the kidneys. Panadol itself can damage the liver. Panadol itself, if taken too much, can damage the kidneys. One has to be careful the way he takes drugs which kill pain. People are even taking these drugs when they have ulcers, pain, which can easily cause perforations and death.
Dr. Karuhanga says you need to respond to your body's reactions by visiting the doctor for assessment, not by self-medication.
Sometimes Panadol may not help, so we go in for the so-called non-steroidal anti-inflammatory drugs.
Many manufacturers of painkillers add contents to provide quick relief, and they also advertise as such. But just in case you think quick relief is safe, then you need to understand what drugs you are using for your self-medication to ease the pain. For people with acute pain, opioids can be used alongside other drugs, including commonplace painkillers like paracetamol, ibuprofen, and aspirin. But they have been linked to many adverse side effects like addiction and death.
Some people can take more stronger drugs which originate from a plant called opium, and these are called narcotic analgesics, to which people can get addicted. Examples are morphia and codeine. These ones will also have the addictive properties because what they do is the way they make changes in the brain. If one does not take them, one will have very nasty symptoms, and one will sell even property or anything to make sure he takes these drugs. And this is one reason why there are prescription drugs.
When treating patients who are dying, meticulous assessments of the causes of pain are needed to understand the best way to relieve it while minimizing potential side effects. And if used appropriately and in amounts appropriate to patients' symptoms, opioids are not only safe, they are essential for good symptom control.
Such drugs like morphia are still given despite the fact that they are addictive, and eventually, of course, we get the person dying but not dying in pain, because it is pain which is a nasty feeling that everyone will want to be stopped immediately whenever it appears. When we give drugs like the so-called non-steroidal anti-inflammatory drugs, we have to explain that they are likely to cause peptic ulcers. Take them with food or take them with a drug which stops acid production.
But the good news is that for some cases, the regular use of painkillers is safe. For example, for women who go through painful menstrual periods.
Fortunately for them, this pain comes only during periods, meaning 3, 4, 5 days in a month, and they will take them during that time and stop. But if someone has a very chronic pain and takes these drugs for all the time, this is likely to cause a lot of problems. And
better education and training might be one way to make sure painkillers are used appropriately for those who might benefit, so that potential harm is avoided. And this is a call to you out there to take control and take care of how you use painkillers. Walter Mwesije.
National Medical Stores, NMS, passionate about your life with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.